Welcome back. It's Survivor Season 2. You just heard Rochelle's story. And we want to commend her once again. She's been so courageous and brave to tell this story so that women can be aware of these predators, these sickos, as I call them, out there, who unfortunately, in many cases, are not being brought to justice. So they're still roaming about out there. And women and girls, and in some instances, boys and men are at risk. Our guest in this segment is psychologist Daryl. So Daryl, you just heard that story.
Yes, I did.
It's almost 6 months into it, and you can see how emotionally raw she still is.
Yeah, the impacts, the psychological impacts of something like this can continue, if not treated properly, for years, sometimes, depending on the individual.
So, some say rape is one of the worst forms of violation anyone, male, particularly female, because most of the victims can't ever endure.
I think it is. I don't think it's a case of it being probably the worst, is the worst thing that can happen, because you are completely powerless at that point in time, all right? Any control you have over yourself, your body, your will, it's taken away from you at that moment in time. So it is the worst kind of violation that you can think of.
What do you get from that conversation with Rochelle, most about where she is psychologically, emotionally, mentally?
Right. Very clearly, as you said, she is not over it. And I mean, I'm saying over it to mean having recovered from it to the point where you can relate and talk about it without that outward emotional reaction. I think because there are also some physical, some ongoing, also reinforcing or rather preventing the emotional recovery of it. As I was telling you off camera, you know what? What really got me was the part about the trainee being the one to counsel her. As a seasoned person in the business and someone who has taken lots of time away from work to go on training and to be taught by others how to deal with these kind of situations, I can't begin to rationalize that. I think
that they would send the trainee to deal with something as significantly impactful as this.
Yes.
What does Rochelle need now?
All right, closure. And closure comprises of a number of different things, all right? She needs closure in terms of the investigation into the case, because as long as a victim feels that the person is still out there, there will always be a feeling that this could happen to me again, all right? So she needs that kind of closure. The medical treatment for whatever her ongoing symptoms are, there needs to be, definitive dealing with that and ensuring that whatever is happening with her stops. And of course, the psychological as well. She needs focused trauma counseling, specific for her situation, that can help to reduce the emotional impact of the story. How I explain it to people, it's like going from being in the middle of a scene to being able to sit back and look at the scene from a distance, like it were television, or something. I mean, you're seeing it, but you're not as emotionally impacted by it again because there's some distance between you and it. And that's what focused trauma counseling can do.
What can happen if this counseling doesn't occur? What kinds of impacts can this have on the other aspects of her life and significant aspects of her life?
Right. She already mentioned that it has an impact on her perception of men. So she didn't talk anything about a personal relationship. I don't know what her domestic situation is, but very often you find people not dealt with, it impacts their ability to relate normally in a romantic situation with a partner. It impacts their ability to trust others. Sometimes people become what we call hypervigilant, and they become overly careful. Now, I mean, some people would argue and say you can't be too careful in Trinidad, but you can't actually be too careful.
To the point of paranoia.
Exactly, where every time you walk down the road, I mean, in extreme cases, people develop social phobias where they can't even go out in public anymore. They can't interact with people in a grocery, in normal everyday settings. So it can get that bad. Now, with her case, because she can actually still talk about it, that's a sign of some kind of recovery going on. But recovery can stall, and it can remain at a particular point in time, and your personality can be altered forever, and you may never get back to being the person that you were before it happened.
What about her children? She's a 9-year-old who...
Yes.
9-year-olds are pretty aware these days.
Yes. 9-year-olds, now they may not understand all the mechanics of something.
But they know something went wrong.
Yes, they know something went wrong, all right? And did she say it was a boy? It was a son?
Yes,
all right.
2 sons she has.
Boys are very protective of their mother, just like how little girls are very protective of their father. So that can have, I don't know the level of interaction, obviously, but it can definitely have an impact, particularly on the eldest one, where, he may feel that he has to protect mommy, because, you know, something went wrong and he needs to look out for her, and because of the stage of development he's at, that also can play a role in his development going on, in terms of his attachment to her and his, you know, fear for something to happen to her.
Does someone who's been through that type of horrific ordeal ever really heal fully, ever really get over it? Or can they get to a point just where they can function as normally as possible?
Right. Paul, it's like dealing with grief. All right? If you have ever lost someone close to you, you never completely get over it, but you can get to the point where, as you said, you can function. You can talk about it. You can look at pictures of the person and laugh and remember the good times, as opposed to how it felt when they passed away, all right? So in a sense, you never get completely over it, because there will always be some pain there, but you can get to a point where you can, as I said, you can relate it as an experience, something that happened a long time ago, a one-off type situation. You can talk about it, and, you know, you can function.
Final 2 minutes. What's your advice to women? Rochelle is pretty brave. She is
extremely
courageous in the face of criticism.
Extremely.
There are many women out there who go through it and just shut down because of society's perception of them. What's your advice to them in terms of getting either help, counseling, or getting through this themselves, if that's possible?
Right. You cannot get through this by yourself. That's the first thing, all right? Now, because rape is it can be a particularly embarrassing experience, people tend to want to not to share their story. They tend to not to want to reach out, okay? Like I've said earlier, there is help. At least I can speak from the psychological, emotional side of it. There is help, okay? There's a psychology association. If you don't know of anybody, or if your company doesn't, if your employer doesn't have an employee assistance program, there's a psychology association which is reachable via telephone and so on. You can call, it's confidential, you can relate the situation,
and
you can get some kind of help.
So yes. There's no fee attached.
Yeah, absolutely, absolutely. Things like that, you know, most of us who are in this profession, we're not in it for the money, all right? So we will be, you know, open to doing work, that kind of work. Yeah, to helping people.
Daryl, thanks so much. We appreciate your time.
Welcome, Paul.
I'd like to thank Nesta Flanders and Rochelle Cummings, two very courageous women, for sharing their stories publicly. Sometimes it's very hard to share these stories publicly, but it took courage, and we thank them for that, so that women who are out there who may be experiencing similar circumstances may have the courage to leave or get out of those circumstances. And we also spoke to psychologist Daryl Joseph. It's interesting that we keep sending the message about the signs of abuse or the signs of an abuser. What are the signs of an abuser, the early signs that one may look for?
Control, isolation, violence, verbal abuse. Even though people downplay violence, they focus more on physical. Verbal abuse is something very prevalent, and that's an early sign also. They intimidate you, humiliate you, and you think it's love, but it's not.
That's sometimes women mistake it for attention.
Attention, the constant calls, the constant checking up on you. It's not that they love you. It is that it's a sense of control. They're trying to isolate you, and they are trying to seize control so that you're powerless.
Or it's some kind of twisted love. It may be love, but not love that's healthy.
It's a dangerous love. I mean, there's no denying that they may love, but it's a dysfunctional love.
All right, we hope people are heeding the message. Once again, we'd like to thank our guests and you for viewing this season of Survivor Season 2. I'm Paul Richards. On behalf of Alana Mahias, thank you for viewing, and good night.